The Michael Berry
So
Show.
one of them that I've been pestering with questions like this for a long time is Dr. Will Davis. And the good thing for me with him is I watched him transition from part of a practice to being concierge, from the asking questions about, working through how this would work financially, professionally, time-wise, patient-wise, and all that. He doesn't just take all comers. Now you've got this group of people. You're like a pastor. This is your flock. These are your people that you take care of. You develop a relationship. So when they call, you don't need them to fill out 15 documents. You know their story. You know their spouse and their whole family. I think it's pretty cool. It feels a lot more like what I grew up with, which I think was a pretty good system. Dr. Will Davis, welcome to the program.
Thank you, Michael. I appreciate you having me on this morning.
Don't get all formal on me now. We've smoked too many cigars together. Of course, that probably ruins your credibility. If people knew that you have a better bourbon collection than I do, and you may smoke more cigars than I do, I'm not sure they'd still trust you, but I do. I think I see how people respect you as their doctor. Let's talk first of all from the doctor's perspective about why this made sense for you to go to Concierge.
Well, so I had been in practice for about 20 years at the time, or 21 years, and they had actually, the company that I partnered up with called MDVIP had been looking out, asking me to join their group of concierge doctors for about 5 years. And I was at the point where I was seeing 35 patients a day. I was getting burnt out. I tried really hard to provide concierge level care to patients doing that load, which really affected me and my family life. And then this opportunity came along and I was like, I think it's time to make a change. And for me, it has been a absolute blessing. I mean, I think I've gotten a little bit of quality of life back. I'm a much better doctor than I ever was before because I know my patients better. I'm able to discuss things with them in a longer fashion. They have much greater access to me. And like you said just a minute ago, I don't have to review a whole chart just to know who they are. I know who they are just because of the patients I've been taking care of for a long time.
So, we've talked over the years about, I don't know, say burnout, but frustration. And, you got into this to help people, to heal people, to treat people. What about the practice where you were, the way medicine was being practiced? How has that changed for you? Why did you make this change in that way?
So do you mean why did I go switch from 35
Yeah.
patients to like 10 to 12 a day?
Yeah.
I mean, I just think it made more sense for me to go ahead and, get some control back in my life, which I think this has allowed me to do. Like I said, I can actually enjoy my life more now outside of work when I'm still, as you said, I mean, we may be at a dinner or something and I'm taking calls or texts from patients, which is totally fine and I'm happy to do it, but I don't have to be at the office all the time. And it allows me to work and see, instead of, see 4 to 10 patients or 12 patients. And my patients can get in same day, next day. I mean, my patients, really enjoy it because they have that access and availability to me that they never had before.
Well, and I think the great frustration that I hear from the patient perspective is the idea that the doctor doesn't have time for you. And it's not because he doesn't want to. It's because the MBAs took over. I remember in the early 90s with Hillary Care, and it was the battle was it going to be a company like a private equity type group buying out these HCA type deals, buying out the practice, or was the government going to take over the practice? But the doctor was no longer going to control the practice, and that was very clear. Let's talk a little bit about the way your practice works. So you sent me the email yesterday that you send to a new patient. But in a minute and a half or so, walk us through, as a new patient, what this looks like to be your patient.
So basically, a patient will come into the office. We do a meet and greet. I go ahead and tell them the amount, which is, it's a little over $2,000 for a year, and they're able to use HSA or FSA. They go ahead and they come in and they do a pre-physical evaluation and then come in and do a physical. And so we go ahead and talk about why it makes sense for them to go ahead and do this. And a lot of them are frustrated. Like you said, they can't go ahead and see the doctor when they want to. They go ahead and they wait for hours or days, to be able to be seen, where we can see them in a very quick and timely fashion. So then they go ahead and have this, and they can get their high quality physical. And we do what's called an executive physical. So we go above and beyond what is traditionally done in most offices to go ahead and try to create a much better picture of a person's health rather than just a couple of numbers. And again, my patients are not just numbers to me, they're actually real people. Where before, based on all the old restrictions by the Medicare, the traditional insurances, the hospitals, where you have to follow all these rules, and now you can do more.
Will Davis, when patients transfer over to, I'm guessing a lot of your, however many patients you have, hundreds of patients, a lot of them were already with you and then just moved over to the concierge practice when you changed over to that?
Yes, sir. So a lot of them were originally patients for a long time, and then most of my growth over the last 6-7 years has been through word of mouth from either family members, spouses, friends, and that's how it's grown. And, it was one thing, Michael, I meant to say earlier is, you mentioned before is that for me, I think I had 2 older doctors who are my mentors who are now passed, but we're basically, as concierge doctors, old school doctors. It's back to the old style that you have that relationship your grandparents had with their doctors.
I think that's important. When the MBAs took over the practices and started trying to wring money out of them, which is what you do. It's business, but people had, this wasn't business. This wasn't trying to make a few more pennies off of Coca-Cola or a ticket to a concert with more fees. This is intimate, man. Especially when you have concerns. You got a lump. What should I do? You've got something wrong. What is the point from which I can't pass my bowels for 24 hours becomes 48 hours? What's the point where there's a danger zone? There's shame. It's raw, and these are the kind of things that you want to trust the person you're talking to. And I think that more than anything else, more even than the dollars and cents, I think that matters to people.
I agree. I mean, I think, to a lot of degree, I'm as much of a therapist at times to my patients as I am their doctor, because they can come to me for anything. And I really tell them, some of them hesitate to actually contact me because they don't want to take up my time. And I'm like, look, if you have a problem, you need to let me know, because I can't help you if I don't know. And I mean, is again, one of the things I like to say, a lot of doctors think that it's a privilege for a patient to see them. For me, I like to always say that it's a privilege for me to be able to take care of them.
Well, you are in a situation a lot of doctors are not. Your bedside manner is fantastic because you are very social, very easy to communicate. You like people. You're interested in people. I think a lot of doctors traditionally, before this was such an important thing, were all about the science and the healing. And I find when people say so-and-so's a great doctor, they don't know how well he cuts when they're under anesthesia. They don't know how well he recognizes this lump or that. They know that he's likable, and likability is key in your politician, in your doctor, in all of it. How do folks reach you, Will Davis?
So most of the time they will text me.
No, but
how
does the general public, if you're taking new patients, reach you?
So they could call my office number, which is 713-783-9287, or they can look me up on mdvip.com under Will Davis.
Now, it says Memorial Hermann Health System. Are you associated with them in some way?
So I'm affiliated with them through a program called MHMD, which they go ahead and help us manage certain contracts and certain other So it's not a full affiliation, but it is partial.
It's a back office thing. They need more docs so that they can get the group buying discount. You need their back office. It makes sense. And you are at Gessner and what?
Westheimer.
Gessner and Westheimer. All right. Dr. Will Davis, thank you, buddy.
Yes, sir. Thank you, sir.
Dr. Steelman.
Hello.
Welcome to the program, sir.
Thank you.
So tell me about your practice and when you got into this concierge model and why.
Sure. So we are a concierge direct primary care office in Shenandoah, Texas, just outside the entrance to Woodlands. And we started about a year and a half ago. The why was pretty easy. Just all of my patients in the hospital kept asking me to open an office, and there weren't a whole lot of primary care docs around. It was hard to get an appointment.
So what does that look like? What does a patient pay to get started? And then Do they file their insurance with? How does that work?
Sure. So our version and a lot of these are very similar, but also a little bit different. So you'll find variation between all different kinds of concierge practice. But our model, the direct primary care model, is based on a low cost monthly membership, and in exchange for that, you get no copays. You get all the services done in the office, house calls, texting 24/7, access anytime you want. At no cost. There's no charge for office visits or anything like that. So we try to lower the cost for accessibility. It comes right now. We're at $125 a month with no enrollment fee, no required membership. We want everybody to be really happy with the service.
What do you find your patients find most rewarding about being in this concierge practice?
Sure. It's really individual what they're looking for. We see a lot of different patients that have different needs, but the biggest thing is just having access to a doctor is not rushed, and mostly that we're very independent and not influenced by insurance or by government requirements and things like that. So we operate outside of any of that insurance influence.
And how does that matter, practically speaking?
I mean, it's actually really, really easy to see, and we're very, very transparent. That's the first thing, is that in healthcare, one of the bigger problems that we have is that nobody knows how much anything costs. So with our practice, we make a big emphasis on being very transparent. You see the actual prices with us, and everything that you get through us after you're, paying the membership fee is wholesale. It is exactly the price that the market pays. So we pay cash for things, and we can generally get labs, imaging, medications, supplements, things like that, about 1/10 the price.
Right, because we're cutting out the silly insurance scam. And that's the
Exactly.
one. So what's interesting about that is people say they want truth. But for most politicians, other than Trump, they don't want the truth. They want the political talk. Everybody wants to believe that, what I want to be the case is what he wants to be the case, and he wouldn't tell me otherwise. Well, it's funny, people don't want to talk about money, but if you put a sign up front and it says this is what it's going to cost, I think that's jarring for people, and I think that's partly because they've grown accustomed to pretending that that's not going to happen, that there's not going to be a charge. If we don't think about it, we put it off. If I don't think about the exam on Thursday, I don't have to study for it today, and it won't bother me. It won't cause me any concern. But it's the only industry I know of where you go in, the service is rendered, and later you find out how much it costs. Imagine going to Lone Star Chevy. You go see Mike Batchis, the GM. You decide which one you want without any regard to what anything costs. I really like that when you drive off, and 3 weeks later you get a letter that you owe X amount of money, and you had no idea what it is. You hope it won't be bad, but you have no. It's just insanity. That's your turn.
Yeah, we agree. So our, one example we had this is every single week for us, but we had one patient come in for sick labs. They had been thrown up and real sick for about a week or so, and we sent them off for labs. We have a national GPO contract to get our labs. A full comprehensive panel to get them straight was $21 with us, and cash price with insurance was $383. I mean, that's there's no question where the value is.
Well, what people may not know is when you go to your doctor, there are very likely as many people, if not more, in a back office who are handling paperwork, fighting with insurance companies all day long, and trying to get what service they delivered to you, which you needed then. You were sick then. Forget how important that was. You get healthy and you go, well, I didn't know you needed it then. And that's not the delivery of medicine. That is stupid paperwork. We went to San Antonio this weekend, brought my brother-in-law and sister-in-law, my wife's sister and her husband, and they live in India. And we were planning the next day what time we needed to leave because where we needed to be because we had reservations. And they said, and I said, we'll leave 30 minutes before we're to be at La Fonda, the restaurant, because it's 15 minutes away. And they said, oh, so we need to be down at 8:30 instead of 9:30. And I said, why would you need to do that? And they said, well, we need to check out. It's busy, so I'm figuring what should it take, 45 minutes to check out? I said, no, you don't check out. You just walk out. What do you mean? You can't. And because in India, and they learned this from the British, everything, you stand in line to get a document to get into the next line, and somebody signs it and they don't review it. It's just all of this rigmarole for no good reason. It doesn't help heal people. And to be able to cut through that, I can't imagine how much that helps your bottom line, because now you don't have to have all this staff to deal with the insurance company and all the things that go with that. That's got to be so much more rewarding for you.
Yeah, when we started putting the business together, the billing companies take 5 or 10% off the top from any money you're making in the business. So that's automatically a much better business relationship. So,
The Michael Berry Show.